You cannot explain, you cannot understand the way the brain works in any of the concepts we have. And that's not to say it's magical, but we just don't know, we don't understand it. And I find that infinitely extraordinary. And I also find it totally impossible when operating on a brain, even when the patient's awake. I can't really think, this gooey grey stuff is thought itself. But it is, and that is extraordinary. Brain surgery is quite easy, technically. Most of it's done with a sucker, because the brain is soft. It's a sort of microscopic vacuum cleaner. But what's really special about neurosurgery is it's terribly dangerous. If things go wrong, you can leave people terribly disabled, not just like having a paralyzed leg, but you can change their personality, you can change their ability to think. I mean, it's terribly dangerous, which means that the decision-making, when to operate, whether to operate, is really in fact, it's almost more important than the operating. I mean, the operating you can learn quite quickly. Technically, it's not that difficult once you've done it for a few years. But the decision-making is very complex. And you're making decisions, very human decisions about quality of life. We'd all accept we had a malignant tumor in our leg. We'd all sacrifice a leg to live. But none of us really, I think, would want to sacrifice part of our brain or part of our very being. It's just very different in that sense from other branches of surgery. 18 years ago, just after independence, when the Soviet Union had fallen apart, an English businessman whose uncle was a local doctor near my hospital in London, was looking to take some English neurosurgeons out to Kiev in Ukraine, because there was a big post-Soviet neurosurgical hospital there, and he was hoping to sell English medical equipment there. And he thought if he took some real-life neurosurgeons along to give some lectures, would create goodwill. So I went out there, and of course the situation was terrible. I mean, first of all, Soviet medicine, in particular Soviet neurosurgery, was 50 or 60 years behind the West. They didn't have brain scanners, microscopes, anything like that. So it was like going in a time machine. I then visited the emergency of a trauma hospital, which is a sort of poor relation to the big neurosurgical hospital. And all the electricity had failed. They'd run out of disinfectant, so they were using ammonia for cleaning the place. It stank of ammonia. There was more or less pitch darkness. And this young doctor sort of bounced up to me like an eager young puppy, saying, "Everything is terrible here." And that was Igor. And he was the first person who actually described what I was seeing. And he taught himself English by listening to the BBC World Service. And was a completely extraordinary, driven person. He wanted to change things. And that's where it all began. I'd brought Tanya to London to operate on her because I was banned from operating by the political establishment in Kiev. And it was a very difficult operation, and basically she suffered a major... It was 2 12-hour operations, and she lost vast amounts of blood. And the problem in Ukraine is because it's a backward medical system relatively, particularly something very high-tech like neurosurgery, diagnosis is delayed. So the tumours are much bigger than the tumours we'd see in Western medical practice. So you have a sort of double whammy of bigger, more difficult tumours, and you've got less good equipment for removing them. So, in a sense, by bringing her to London and operating, and she eventually, after many months, got home to Ukraine, but then she died at home. And in a sense, I'd bitten off more than I could chew, and if I'd been a bit more, detached and professional, I would have said, no, I can't do this. But I think as the film shows, it's as a doctor, one wants to help people, and it's very difficult to say no. There's a huge amount of waste in Western medicine. Everything is now single-use, throwaway, disposable, on slightly tenuous infection control grounds. That's a sort of symbol for our society as a whole, and this view that everything must be thrown away and get another one. Well, resources are finite and limited. One thing I'm hugely impressed by with Igor Kurylets's practice in Kiev is he gets equally good results in terms of infection and complications to what I get in London at a fraction of the cost. Everything's sterilised, everything's reused, nothing has gone to waste, and he works perfectly well. We've become lazy in the West, But there's a very big political message for Ukraine in the film, which is about an individual like Igor can make a difference, and he needs to be supported. Or what countries like Ukraine need is to encourage individualism, to encourage people, because it's still a very hierarchical society. In 70 years of Soviet rule, anybody of initiative tended to get shot or sent to Siberia. And now, with the economy in a bad way, there's been huge emigration. About 7 million people have left. So it's a country which needs to nurture and nourish and support people like Igor, because they've got it in themselves if they can start having a freer society.